Welcome to tonight's meeting. My name is Councillor Bora Kwan and I am the Chair of the Health and Wellbeing Board. Before we start, we've got the usual housekeeping points. So the meeting is being live streamed this evening by the council's to the council's YouTube channel, and by participating, you are consenting to being recorded. Please can officers and guests introduce themselves when they first address the committee. Also, please make sure that your microphone is on when you're speaking, because that's the way that you will be recorded. Okay. Item 1 is apologies for absence. We've received apologies from Councillor Natalia Perez, Sue Rooston, Sue Spiller and Dr. James Kavanagh. Are there any other apologies for absence that haven't been sent to us in advance? No? Okay, thank you. And item number 2, declarations of interest. Do members of the board have any declarations of interest? Nope. Okay, let's move on. Number 3, the minutes and the actions of the last meeting. So do members agree the minutes of the meeting held on the 21st of January 2026 as an accurate record? I see no objection, so I think we'll take those as agreed. Okay, now moving on to the reports. Item number 4, we've got the Better Care Fund Q3 report for 2025 to 26. And I believe that will be Sarah Bright. You just introduce yourself.
Evening, everybody. I'm Sarah Bright. I'm the Director of Commissioning, Transformation and Partnerships. I'm back here again with the 3rd iteration of the Better Care Fund report. Nothing much to add, particularly from the last report that came at the last meeting, which was BCF Q2 report. We are same issues in terms of our admissions to hospital, which we anticipated as part of our winter flu pressures. That's pretty standard, but we're on target in relation to everything else in admissions to nursing and residential care, and I think I haven't got the other one right in front of me. Discharge delays, and we are spending in accordance with the plan and the regs of the spending requirements, and it's been done in collaboration with our ICB colleague Sue Rooston, who can't be here today. Any questions?
Do any members of the committee or have any questions on the BCF report? Oh, sorry, that's a motorcycle in the distance. I've been informed that there are some members of the public in attendance who had some questions. So we do have quite a tight schedule. So we might not be able to grant you a question for every single item. But I did see that you had your hand raised up. So would you like to come to this microphone here? Yeah. There's a button to press which will go green to turn the microphone on so everyone could hear. And if you could just introduce yourself so we know who you are. Thank you.
Okay. Good evening, everyone. My name's Bevan Powell. I'm a trustee from Nubian Life. I've got 3 questions that I'd like to just ask around the fund and the report. And the first one, I just want to pull my questions up here. How is the system ensuring that preventative support is reaching older people from ethnic minority backgrounds who face barriers accessing mainstream services? I note in the report, there's a generic approach to ethnic minorities, not breaking them down by different ethnic groups, etc. So we just had a question as to how that's going to be achieved. And then the second question, what role is being given to trusted community organisations to deliver admission, avoidance and early intervention? And my last question is the BCF performance data being analysed by ethnicity to understand differences in outcomes for older people from minority ethnic backgrounds?
Sorry, can you repeat the first question about prevention older people?
Yeah, sure. Okay. How is the system ensuring that preventative support is reaching older people from ethnic minority backgrounds who may face, well, we're already aware of some of the systemic issues that many people from older minoritized communities face. So just asking what are the provisions that you're putting in place to ensure that they are receiving appropriate care?
So the BCF funds a number of initiatives, and there is a whole programme that's set against that. So the spend is in across a number of different areas, including our health providers and a number of community sector organisations, in order to do a lot of that work. We're also focusing much more on our prevention agenda, so that we can invest more heavily in our third sector provision, in order to be able to do that in a much more targeted and streamlined way. So can I come back to you on that question in relation to the BCF, because I would need to look into the specific projects and how they do that.
Okay, and alongside that, obviously, is how you differentiate between the different ethnic groups and cultural differences.
So I know, for example, we do have different provisions for particular community organisations.
Or community groups as opposed to organisations.
Can I just come in to suggest that obviously it's great that we're getting questions in this public forum, but if there are answers and the data that we don't have, can I suggest that we exchange contact details? Because I have a feeling that we will have clearer and more in-depth answers to some of these once we have them in writing, and the team have got some time to respond. So please do keep asking the questions, but as I say, I would suggest that we also exchange contact details properly at the end, so that we can send you further information.
Okay, I mean, that'd be really useful, and also how it aligns with your own inclusion reports, which seems a bit of unalignment with that. Okay, thank you.
Thank you for your contribution. Okay, I don't see any other hands up for questions on this, so I will then say that the recommendation that the Health and Wellbeing Board approve the BCF Q3 BCF report for 2025 to 26. Is that agreed? Agreed. Thank you. Moving on to item number 5, which is the Best Start in Life plan, and we'll be coming to Peter Haylock for this. Thank you.
Evening, everybody. So the Best Start in Life
Sorry,
local
Peter,
plan.
can you introduce yourself, your title?
Apologies. I'm Peter Haylock. I'm Director of Education and SEND, also responsible for family hubs. So the Hammersmith and Fulham Best Start in Life plan works to support young people and families and children up to the age of 5. It links with the government agenda around good level of development at the end of early years, which finishes in reception, and in looking to get us towards our new target of 79%. At the moment, we sit at 71.4%, so we have a challenging kind of 3 years to work towards that. Essentially, the Best Start in Life plan sits behind our kind of shared vision that every baby, young child and family in Hammersmith and Fulham is happy, healthy and able to thrive, supported by a strong, connected and responsive community network. This links in with our shared principles that are very similar to the principles that we have, for example, within our SEND strategy and other areas. And very much kind of focuses in on families feeling welcomed, included and valued, having a voice, having their needs identified early, etc. The Best Start in Life plan has been put together through some really strong co-production work across the different services. So essentially, 5 key services coming together as part of this plan. Firstly, you have public health, working obviously with families from maternity onwards in terms of what's required to support them in those needs. Secondly, in terms of family hubs and looking at the support that they can provide, obviously from birth or even before, and supporting the young people and families with the support that they might need. Thirdly, with our early years team and the early years providers, where they will work as young people and children are accessing childcare or accessing our early years provisions or our maintained nurseries or PVIs and getting the support they need. And finally, our schools team, as obviously the final year of the good level of development measurement comes in reception when the vast majority of children have joined school. The 5th team will work across the whole lot, which is our social care team, linking very much in with the family first agenda as well. So the Best Start in Life brings together some positive work that we've got across different streams already, and will kind of essentially work with children and families to support them in the kind of early stages of their development, with the intention that obviously 79% or more meet the good level of development target at the end of reception.
Thank you. Do we have any questions from any or comments? Yes, Councillor Sanderson.
Thank you very much, Claire. Councillor Alex Sanderson, I'm the Deputy Leader. So I just wanted to say I think this is a really, really strong paper and really love the way that it is going to be working across different departments to make sure that the children are getting the very best start in life. Just thinking about tracking first of all child journey, could you talk us through how they'll be tracked, noting in mind that there will be different departments and there'll be health, all sorts of different partners that we're working with. So how are we going to track that journey to make sure we're getting data in the right way? And also, could you talk us through whether we'll be looking at delivery or impact, if that makes sense as a question? Thank you.
I'll take the second question first. So we'll look at both because some of it will be around improving access and then looking at the impact of that access. So, for example, we want to ensure that larger proportions of families are accessing early years providers that we think are good or outstanding, and therefore potentially are getting a kind of better provision earlier in their childhood. So we would look at where they're accessing it at and then what the data would lead to. In terms of measuring and tracking, we will operate an internal board that will run through the Families First network. And essentially, each of those 5 teams that I just mentioned will report in once a quarter in terms of the progress they're making against the clear actions and key KPIs that are within the plan. Once that board will then also report into CHESC, which is our kind of wider group in terms of Children's Health, Education and Social Care Board, and that will enable us to kind of measure the accountability mechanisms. We'll use similar tracking and methodology that we've been using in the last 3 or 4 years in the SEND delivery group. So we'll look at, we've kind of mirrored the templates against that, so you can see the actions, what's working well, what's completed, where we've got potential gaps and why those gaps might exist for the different services.
Are there any other questions? Yes, Diane.
Hi, I'm Diane from Healthwatch, Hammersmith and Fulham. I think it's great to see so much co-production and so many groups involved in developing the work. What I'm struggling to find a wee bit is how they influenced what you were doing and how they will almost have a say in measuring success. And I don't know whether there's an opportunity to, you know, if it's parents and young people and children, they'll be using a whole range of services. It's about how you kind of bring them together and share insights across the different services. It's almost like integrating your co-production and your insights and then following that through the whole process. I'm not really sure how they influenced it, then how are they going to be used to measure success, I guess is what I'm asking.
So the different services have been involved in creating the plan, and they've been involved in defining the KPIs. And I completely understand your point that if you look at the specific KPIs, they don't necessarily lead to the ultimate target point. I think the key point with the best start in life is to almost ignore the target and focus on the progress. So what we're aiming to achieve, for example, if you look at public health and looking at immunisations or something like that, it's a completely separate piece of work to, say, for example, ensuring that a larger proportion of our young people access good or outstanding childcare or early years provision. But equally, both of those two things, we believe, will lead towards the ultimate point of a young person achieving a good level of development. And I think the key is that looking at the kind of partnership working and bringing those people together has been a really positive thing in terms of looking at the holistic view of a child and the progress they can make. And moving forward over the next 3 years of the plan, that will be the things that we'll be focusing on rather than looking at the target.
I'm just wondering if you can join up the insights as well and the feedback. I mean, I think that's brilliant. I think what you're doing is great. It's just whether you can join up what their residents, I guess, lived experience across the services.
Jackie McShannon, Executive Director for People. You're absolutely right to ask that question. Actually, that that involvement and co-production is very much a feature of how we work. And Peter referenced how we program managed our SEND reforms, and we've now got a plethora of reforms, and actually one of the big strengths is putting them all together so that we're consulting with people purposefully, meaningfully, and not duplicating it. So, for example, we met with partners, health partners, earlier this year, January, and again with children and young people who, for example, are involved in children's social care services. And all of that feeds into an overarching programme. And one of the things that Peter referenced was the fact that we're bringing it together with the families first. So as I said, there's lots of reforms going on, and we have to be intelligent about how we engage with our young residents, older residents. I remember Nandini Ganesh from Parents Active talked about, don't forget the hundreds of everyday conversations, in fact, thousands of everyday conversations. And that's something actually this borough, I think, is very strong at capturing and feeding it in. So I hope that through the programme management and the reports that we bring to you will reflect that.
Thank you. Yes, thank you.
Hi, I'm Navneet Willoughby. I'm the Director of Operations for the Inner Boroughs at Central London Community Health. And I just wanted to echo Peter's comments around the paper that we are very much involved as providers of children's services, both from a public health nursing, school nursing, but also our speech and language therapists. And whilst we are required and work with partners around our kind of contractual metrics and performance, we're also very much ensuring that our staff feed into the co-production work, the feeding back, and the very much priority for us is supporting the Family Hub's agenda. So just to sort of demonstrate the partnership working that we have and are committed to.
Thank you very much. Yes, Councillor Rowbottom.
Thank you very much. So I'm Helen Rowbottom. I'm the just about still Children Education Pact Chair. Peter, I wondered, because I know this is a new sort of strategy that will bring together things. I wondered if you could talk about where it had come from. And I note the governance entities, although I wasn't quite sure on how it will report or influence through. What would be, in terms of the local government ICB collaboration, is this going to influence strategy spend for ICB policy, or just a bit of background and what the kind of clout is of this group?
No, I don't. It won't influence any spending at ICB level. The ICB have obviously been involved in the kind of the co-production of the plan, and will be involved in working with us in terms of the service delivery, etc., and supporting some of the things that Navneet's just said. So the plan has come from essentially from the DfE directive to create a best start in life plan. I think we've just approached it from the perspective of not just looking at what needs to be done around the reception target and the good level of development, but looking at creating something that's more holistic and is looking to build on the strong partnerships that we have and ensure that they are involved in the delivery and looking at how, as Jackie was saying, how the different elements are joined up.
Got it. So it's a bit of a directive from above. Understood. Thank you.
But just if I may, Chair, it's a lot of stuff that we were already doing in many ways. It's just formalising ways of working.
I think the key is it gave us an opportunity to bring together some. So the work you've heard about in terms of family hubs is a good example. We don't necessarily speak here or other boards about the work that early years providers do. You would have heard at CPAC about the strong work that schools do, but not necessarily in reception, because obviously that's only 1 year out of 17. So I think this just gives us an opportunity to bring all of those different work streams together, along with a lot of input from public health. As you'll see from when you look at through the actual plan, quite a significant amount of the actions and the targets very much link into the agenda that public health has around immunisations and all of those other pieces.
And just a final word from us. I think the way we have organised ourselves in the borough, bringing together, for example, adults, public health, along with education, SEND, children's social care and commissioning, places us very well. And I think that in terms of that join up that people have been talking about and avoiding the silos. So I think we're in a very good position, and we're building on a way of working as opposed to having to invent it from new.
I should have said one other thing, apologies. So the plan has to be published by the 31st of March. But the DfE are clear that it's an iterative plan. So there's not an expectation that it sits static on the shelf. The expectation is that you are looking at the different actions, the different work that needs to be taking place, speaking with families, speaking with particular groups, etc., and looking at how the plan molds over time. Sorry.
So it sounds like it needs to be a sort of dynamic strategy. Okay. I think given the importance of, what we now know about early years and so on, I think it's vital that we all help in making sure that the plan succeeds and so on. Can I just ask what you think there are major sort of challenges that might maybe not prevent you from getting, but things that you're kind of anticipating that could be difficult, just so that we can think about it and make sure that the plan succeeds?
I think probably the biggest challenge is ensuring that the right families get the right support at the right time, and it's ensuring that join up between different groups and thinking more creatively and differently about how we get that information to the right families at the right time. And I think that's something that we've been working on in terms of the family hubs and some of our other work already. But we know that as we've discussed at other boards previously, we know that that's still a work in progress, and how we utilise different groups and different methodologies to get the right information, whether it be public health information or information about family hubs or information about schools, getting that to the right families so that they can get the support that would potentially really benefit them and their children.
And going forward, is there, do we know when you'll be able to come back and sort of update us on sort of how things have changed? And so is there a plan, or will it depend on how the situation changes?
I think, Councillor, it's a 3-year plan, so we'll see. No, so I can come back in 3 years. No, I think, I think realistically, it probably makes sense to look at it annually. Obviously, the early years data will come in July, but then there's a lot of other metrics that sit within this, as you mentioned before, that we need to look at a bit more holistically over a period of time. But I think annually is probably a useful method.
Great, thank you very much. Okay, I will move on. Thank you. The recommendation is that the Health and Wellbeing Board note the report. Is that noted? Noted. Thank you. Okay, item number 6, we are moving on to the Memorandum of Understanding. So I will come to John for that.
If I, Councillor Kwan, John Morley, Interim Director of Adult Social Care. If I can please pass you over to Dr. Vincent Law and my Assistant Director for our Mental Health Services, Sarah Ross, please.
Good evening, Councillor Kwan. Sure, I think we are here with Sarah to introduce this piece of work that we jointly produced. I think since 4 years ago when we lose the Section 75 agreements.
Oh, sorry, could I just ask you to introduce yourself again? I know that you know lots of members, but just for any member of the public.
On that. My name is Vincent Law. I am a consultant psychiatrist in background. I'm also the Borough Clinical Director for Hammersmith and Fulham, working in West London Trust. I'm here with Sarah Ross.
So I'm Sarah Ross. I'm Assistant Director of Specialist Services, which includes mental health in adult social care in Hammersmith and Fulham.
Apology for being so eager to tell you about some of the work that we have been trying to work on. So over the 4-year period when we came off the Section 75 agreement, I think there are room to improve on how we jointly work together to be clear about how we our responsibility and some of the scope of work. And maybe I can pass on to Sarah to tell you more of the details of the work.
Oh, hello. So basically, we want to work more closely together. So we're aware that our Section 75 agreement lapsed a long time ago, and that we need to work more closely together in this space in terms of mental health. So it was actually Caroline and colleagues prior to me starting at Hammersmith and Fulham that started the work of pulling together a process whereby we could operationalise that. And that's what the memorandum of understanding is really about. It's not about funding, it's not about finances, it's about a wish and a will to work together in an integrated way to get the best possible outcomes for people that are mentally unwell, and to prevent people from becoming mentally unwell in Hammersmith and Fulham as well. So we've started the work, and underneath the memorandum of understanding sits what we're calling our working together framework, and that we've designed as having 4 separate work streams with different people on each of those different work streams depending on what they are. So we've got what we're calling the hospital journey. So rather than calling it the discharge pathway, which is about person leaving hospital, it's about their journey the whole way through. So the work we do from start to finish. We've then got our community pathway, which is exactly what it says on the tin. Us in the mental health hub in Hammersmith and Fulham working more closely with the MINT teams in the trust. We've then got the forensics pathway because we recognise that we need to do some more collaborative work around with our probation colleagues and with health and social care around that pathway. And then we've got what we call our onward pathway or our onward journey, which is about how do we make sure that people have those gloriously ordinary lives once they are discharged from hospital? What does that look like? How can we ensure that their voice is heard in what we commission for them? So that's the sort of core of the memorandum of understanding, and I think it's been a really positive piece of work, working really closely together. We've got a mental health steering group which Vincent and I chair on a monthly basis, where we have that high level overview. But then we've also got an operational group, and there's also task and finish groups going on under each different pathway as well. So the work's really starting to take pace. So yeah, that's what the document's about. It's about asking you guys to sort of agree to us moving forward with this plan.
Thank you. Okay, do we have any questions? Councillor Sanderson.
Thank you very much. I wondered first of all if you could just say what section 75 and section 1117 are.
Oh, sorry. So section 75 agreement was under the old NHS and Community Care Act, I believe. And it was basically quite a hefty document that a lot of local authorities and trusts, mental health trusts particularly, that's my background, mental health, would sign up to. And it was had a lot of stuff in there, including finances and things like that. So it was about how they would work in an integrated manner to provide the best care for people in the community and in hospital in that mental health sphere, in that mental health world. So yes, that's where the section 75 agreement is very old. Lots of local authorities and trusts don't have them anymore. And section 117 is it's part of the Mental Health Act, and it counts. It becomes valid when someone has had a detention in a psychiatric hospital on a section 3 of the Mental Health Act. So it doesn't, if you're on a section 2, it doesn't apply. A section 3, it does apply.
And you want to say what those are as well?
Yes. So, okay. So section 2 is 28 days or 6 months?
28 days.
28 days, sorry, assessment for someone in hospital. So they can be detained into hospital against their will. Lots of conditions involved. Brilliant practitioners like Vincent and his colleagues, and our approved mental health practitioners obviously are involved in that. And then a section 3 is something that you might have moved on to once that section 2 has finished. Am I getting this right, Vincent? And basically, when you go into a section 3, it's more about treatment, that continued assessment and treatment. So what the Mental Health Act says is when someone leaves hospital, having been on a 3, they've had quite a considerable amount of time of mental ill health at acute level. So actually section 117 provides care for the person. So it's the pathway of funding, if you like, and it means that the local authority and the local ICB basically have a duty to fund that section 117 aftercare plan, which is specifically in place to keep someone from relapsing and coming back into hospital. Is that okay?
Thank you. Great. Because it feels like a really important step in strengthening partnership working. Yeah. I guess the key is just ensuring how it translates to consistent, measurable improvements in how residents experience the system. Will there be shared data that allows us to track outcomes across the pathway?
Absolutely. So we've been looking at data recently. That's like our next thing. So So I'm just pulling up my notes. So in terms of this, there's different data around each of those different pathways, but for example, for the hospital journey pathway, we're looking at reduction of average lengths of stay. We're looking at occupancy within the hospital and hospital beds, which obviously we know we've got too many people and not enough beds, so it's all about that. Reducing our clinically ready for discharge rate, so making sure that people are getting moved on quickly to appropriate placements outside of hospital. And also another one which I think is really important is reducing readmission as well. So we're not discharging people and they're bouncing back into hospital. So we can map those across the data that's held by our colleagues in the trust and also what we hold in adult social care as well, and bring that together and get some really rich data together so we can see whether what we're implementing is working or not. And I think that one thing I wanted to really make sure that you understood is that we're very much doing this as a co-produced piece of work. So each of our pathways will have an expert by experience and carer, and also we're bringing our advocacy services, sort of our independent mental health advocates into the mix as well. So we want to make sure that everyone's opinion is listened to so that we can get the right outcomes for people.
That's great. That leads me very neatly onto my next question, which is about inequalities and tracking whether different communities experience the pathway differently, particularly when we're thinking about discharge, access to services and outcomes.
Yeah. So part of the data that we hold, both with our health colleagues, and in adult social care through our data, will identify people that are coming from different cultural backgrounds, people with different sexual orientations. So that's something that we can pull out and we can narrow down in the data to see what the readmissions are for people with certain characteristics. So that's part of what we'll be pulling apart within that data. We're also really lucky we've got a member of the adult social care staff who is doing a doctorate research paper around what it's like to be detained into hospital, what that journey feels like. So we're going to also bring that into the sort of feedback, the data, the qualitative and quantitative data. So yeah, that's definitely something that we look at. We're particularly interested, obviously, with so the Mental Health Act is having some big changes coming into line, and we're really aware of certain people that we don't want to be detaining into hospital. Our young people with neurodiversity, people who've got a diagnosis of personality disorder. So we can get under all of that data together as well and work out what the journey looks like, out the other end of being in hospital.
Great, thank you very much.
Thank you.
Yes. Yes, I'll come to. Are you attending on behalf of Sobus?
Yeah.
Yes, thank you.
Right, Ashad Hyberton, Head of Engagement Partnership and Deputy CEO at Sobus, and also Chair of the HNF Mental Health Forum. So, Sarah, you answered some of the things, but this is an understanding between West London and LBHF.
It is.
I can't see the word co-produced in there, and where the VCS sits, and in terms of input into that. And I'm glad that understanding has been developed, because a commissioner who's now left LBHF, Adult Social Care, told me, Shad, the reality is mental health is broken in Hammersmith and Fulham. So I think that's hopefully the start of a journey of kind of addressing that. But I think that in terms of early intervention and prevention, it's really important that the VCS and communities are engaged. When we did the BME Mental Health Landscape Research Report a few years ago, we made certain recommendations. We're going to follow up on that research and come back to West London Trust and to see what progress has been made. And also the issue that Bevan raised about lumping together minorities into larger categories. Someone who works within the system told me, Shadow, surprised that Black other and were a lot of people who were subsumed in another category, but were the most overrepresented within the patients of mental health services. So I think there's a lot but I think I want commitment to co-production and genuine partnership. It's too important. We're getting a lot of organizations, a lot of individuals. We support organizations that set up, and a lot of parents of neurodiverse children, for example, parents or generally concerned parents wanting to set up CICs because they see that there's a failure in addressing their needs by the statutory sector. So I think it's a concern, something that I happy to invite you to the Mental Health Forum, which is
Yes, please.
a collaborative and growing partnership that is reaching out across the sector. Like West London representatives, social prescribers attend that forum, and I invite others who are doing it, involved in various research with black mental health, for example, and other communities. So I think it's really important that you engage with us, but I'm glad to hear that the relationship between the local authority and West London Trust, understanding that that's been broken for some time. Yeah. So I just wanted to raise those issues. Thank you.
Thank you.
I'll come to John.
Thank you. Thank you for that. We'll take you up on that offer because I think you're right. Just as I already did.
Sorry.
So just to thank you both, okay, because this should have been done a couple of years ago. That's my understanding. And I know that you're both put in a great deal of work, and personally, I'm really pleased, and we're all really pleased that we've got this over the line. And if I can just say, please, what you're seeing here is the direction that adult social care as a whole is absolutely taking currently. So we're working closely also with our PCN colleagues around new government legislation around neighbourhood teams, which is something that we're working towards with Caroline, Public Health, also with our community care colleagues, because this is very much the future, and we absolutely welcome co-production from appropriate groups that have an interest in those areas.
Thank you. Councillor Rowbottom.
Thank you very much, and thank you for coming. I can see that sort of who has held this has moved around in the kind of background section in terms of governance, let's say, and that now it would, correct me if I'm wrong, that you have a more direct link between council and you guys. Do you think, is there anything that will be unlocked in that kind of more direct relationship, or is there is there anything that's changed, or you want to particularly highlight that this new arrangement has added in, or that a more direct relationship could unlock in terms of impact?
We've already had some really positive feedback. So we're doing some work within, because we know that we haven't got enough mental health beds, and we're working much more collaboratively. So we've got 2 social work staff that are working, are answerable to us, but are working within the hospital itself. And actually they've been in post for about 4 weeks, and that's already the relationships within the sort of hospital teams moving on to the discharge process. I think the feedback from our health colleagues is that it's working much better. So people are getting a much smoother and a much better kind of flow through the hospital, and understanding what their journey is going to be, and undertaking all the sorts of statutory stuff we have to do, like mental capacity and best interests and all that sort of stuff. So I think that's already working. Certainly the sharing of ideas and things like co-location, which we've had conversations about sharing some of our resources as well, because I think we're stronger together. I've worked in a lot of local authorities or NHS trusts where it's been an integrated service. We're working really closely together. And my experience is, I don't know what you think, Vincent, but you get much more bang for your buck, I think, but you also get a much better outcome for the people that you're trying to support, because they've just got one person of contact. They're not having to go to health over here and local authority here. So I think we're already seeing some of those really positive changes, and we're only just kind of tickling around the edges at the moment. We're going to be getting this kicked off the ground in the next few weeks.
And I think the relationship is really key in here. So a good example that Sarah has provided around the discharge coordinator. The funding initially has come from health, and it was passed on to Sarah's to enable that. So, with trust and with the framework that's put together, I think there are clearer ways to work together. So I think that will be a better provision to the population in this borough.
Great. That's great that you can have bespoke social care workers that can really hold that task. That's always a great way to do.
Sorry, I must say this. Another really exciting piece of news, I think, is that we had conversations with the Recovery College last week about them co-locating with us, which is look at Recovery College pick people up when they've got a very high suicide rate in Hammersmith and Fulham. And we want that service embedded. It's a health service. We want that embedded in the community, and it's about them using some of our buildings. And just starting those conversations like that around, being in the same place at the same time. Yeah, I think it's an exciting period. See what we can get achieved.
Thank you for having us.
Should join in the civic campus if you're inclined.
I think that's what they're trying to get.
Thank you.
I had a question about sort of, obviously this is between ourselves, LBHF and West London NHS Trust, but would it be appropriate and helpful at some point to also have some input from the police and ambulance as first responders? Because it strikes me that obviously during that path they're often involved, sometimes at crisis points, but not always at crisis points. Sometimes just they are the people that people often reach out to. So their input and also them being aware of this new working relationship might help them in their interaction with those who need the services.
So although the MOU is between us and the Trust, the Working Together framework includes those people, including our ICB colleagues as well, so they'll have some input in it. But yeah, for example, when we're thinking about our forensics pathway, obviously that will include probation, police, community pathway again will include police. So yes, very much so. It's going to kind of grow from the original MOU, the Working Together framework. We need to make sure that everyone's represented in that. And like you say, when people are poorly out in the community, it's the police officer they'll stop. So absolutely the ambulance service that they'll stop. So yeah, bringing those people into the wider path, the wider planning, absolutely.
And also from my provision, so a lot of the crisis mental health care provisions, especially new investments and a lot of the new assessment suites that we are developing, clearly we will link very closely with the emergency service, which clearly will have passage or pathway into utilizing them.
Yeah.
So it's very much a key piece on that.
Mm-hmm.
Yeah, it would be good to hear maybe in the future as an action point, just to start making them aware of this now, because obviously we're at the start of this kind of arrangement, but I think it's probably best to have everyone aware, even if they're not involved from the start.
Absolutely.
Great. Were there any other comments? No. Okay, so lost my place. Do the committee agree and sign off the memorandum of understanding to establish close working relationships and provide improved outcome for residents in Hammersmith and Fulham with mental illness? Agreed? Thank you. Okay, I will move on to item 7, which is the Hammersmith and Fulham Immunisation and Vaccination Improvement Plan, and I will turn to Dr. Mayada Afan for this.
Thank you. So my name is Mayada Abu Afan. I'm the Interim Director of Public Health. So I'm here to present the multifaceted vaccination improvement plan across all age groups. So the ask from the board is to support this approach, a system-wide approach, and then to champion vaccination across all your organizations. And also to note that vaccination uptake in Hammersmith and Fulham is low, certainly lower than the 95% uptake that it needed for herd immunity, especially around childhood immunization like MMR and other vaccination diseases. And then to note that we do have a significant data issues. We are working hard to address, to improve our ability to target our interventions. So really, already, although we've seen some improvement within Hammersmith and Fulham, but the improvement is at a small scale, and it is not really across all borough. It is not borough-wide. It is specific to mainly affluent areas. So there is huge inequality exists, not just around childhood, but also older adult vaccination as well. So really our plan is it does have number of intervention. The first of them is strengthening the system leadership, because, for example, as a council and a public health team, our role is to improve uptake. So we don't commission vaccination or deliver vaccination. So it's how we can collaborate better and effectively with the commissioners and providers of vaccination across GP, secondary care, schools, homes, and community partners as well. Also, as I mentioned earlier, we are working to improve data and develop a Hammersmith and Fulham specific dashboard for vaccination, so we are able to identify low uptake by geography and by ethnicity. And the plan is to conduct intensive engagement to understand levers and barriers for vaccination, and then develop innovative approaches based on the results. So we've tried the call and recall, we've tried sending letters, and so we want to adopt a different approach informed by true co-production with communities. We also want to be better prepared for seasonal vaccination, especially winter vaccination. Our flu uptake is very low, especially amongst people who are eligible for flu vaccination, and also across COVID and other seasonal vaccination. So really, we want to, just in summary, we face significant challenges in achieving high and equitable vaccination uptake, but hopefully with this plan, we will be able to make a measurable improvement in uptake. Happy to answer any questions.
Councillor Sanderson.
Thank you very much. I just want to start by saying I am thrilled to see such a comprehensive strategic approach to vaccinations in Hammersmith and Fulham. I think it is long overdue. I've got a couple of questions, and I wondered if you wanted to give an update on the outbreak that's been happening across London and exactly why this is so important afterwards. My questions are very quickly. You've touched on the inequalities work and reaching different communities. I wondered if you just wanted to go into that in a little bit more detail. Obviously, the data, there's currently a 3 to 6 month lag. How much is that impacting our work at the moment? Is that the case? Is that always going to be the case going forward, or is there work we can do on tightening that data? And then what does good look like in 12 months' time?
Thank you. So let me give you an update on the Menby outbreak. So you're all aware of the outbreak in Kent. Up to today, until I left at just before 6 o'clock, we don't have any cases in London or in Hammersmith and Fulham. The Menby vaccine was introduced in 2015, and it was given to neonates only. It started as 2 doses in the neonatal period, and then in 2025, it has been increased to 3 doses. So 2 in the neonate and 1 at tier 1. They didn't do a catch-up when they introduced the vaccine. So people who are like university students now, they are not vaccinated. And also the catch-up is not deemed effective. So vaccination is not part of the management plan. Now, the management plan is the antibiotic prophylaxis, the hand washing, the respiratory hygiene, and also isolation of cases and seeking help early. I'm actually going to send a letter to head teachers tomorrow about what actions schools can do to what schools' role are. So that's as far as Menby. We are also facing measles outbreak in London. 500 cases since the start of the year. Our cases are much lower than the rest, but UK SHA regards all boroughs in London are at risk of measles outbreaks. So we've sent number of communications to schools, and we are pushing, and also letters to GPs to identify children and adults who are not vaccinated, to give them the vaccine and to do a catch-up as well. So we are working on that front as well. So these are the 2. And I think we shouldn't be seeing cases of measles or mumps or rubella if we reach the 95%. So this is why we need to push especially the MMR very high. In terms of engagement in public health, we do have 50 volunteers. They're called family champions, and I do have 2 coordinators who are really skilled in engagement, and they're working very closely with SOBES and with Health Watch. So once we identify these communities, and then we will develop our engagement plan in conjunction with stakeholders as well, and with community groups. So that is really, and in terms of data, the 3 to 6 months lag, yes, it's not just the lag, it is also the quality of data. So currently it's difficult to determine the wards and of residency or the ethnicity. So we are working with the ICB and WISIX, which is Pan-London Data System, to look at coding at practice level and to look at improving and cleaning the data.
Thank you. Yes, I've got, let me come to Chair first, and maybe in the meantime you could come up and then we'll come to you next. Just to, yeah. Go ahead, yes.
Right, thank you for that comprehensive response. And it's, yeah, we are working. I'm really made good connections with some of your team in terms of that outreach work. I think it's a wider issue in the sense that I remember during COVID meeting someone in White City as I was walking in the area and asking, has he taken the vaccination? No, this is, you know, white man's thing that's is designed to kind of, you know, get at us. But I think that there's, you're fighting also against social media stuff when, you know, I've had what I considered people who should know better and say, look at this Shad, look at this social media app. And I think that's the thing. There's a fear, there's a kind of also myths going out there in the sense. So in the sense, what's happening in Kent is a useful thing to use. I use that. I've already started using that as this is the consequence. Yeah. And I also use the thing that I have cousins who had polio. Now, without the vaccination, they got polio, and there's consequences to their lives. So I think it's about being able to counter those narratives of, you know, we react differently. We do. I know I'm diabetic and I was given medication and I reacted strongly to it. So they changed the medication. So I think it's those kind of things that we need to counter. So I think you've got challenges in your team, but we're here to help and happy to get the messages out. But I think that's one of the key things.
I agree, but the way I look at it, why it is 95% and not 100%, this 5% for the anti-vax, for people who are not going to win. But I think hopefully we'll be able to win the rest. One of the things we learned from COVID is using people with lived experience. So COVID survivors who came and told their story and how they wish they had the vaccine and how they suffered had really profound impact on improving the uptake of the vaccine. Yeah.
Bevan Powell from Nubian Life, and one of the trustees. Thank you. This is such an important area, both for all residents in the area. But one of the issues, and I'm really pleased to hear that the engagement with SOBES, but one of the issues is the historical mistrust around vaccines. So whilst it's really great to hear that you'll be engaging with various groups and community groups, I'm just wondering what proactive activities or programs will there be to really address the whole issue of trust and confidence? Because it's all well and good engaging, but I think we really do need a cohesive strategy to start to address some of the myths that was just described, but historical mistrust in terms of vaccines. I mean, you know, we don't have to rehearse the disproportionate outcomes amongst many minoritized communities.
Absolutely. My answer to that is we will co-produce those strategies, because again, going back to COVID, it's when we did the engagement, and it wasn't in Hammersmith and Fulham, we realized, we asked, so how would you take the vaccine? What would make you take the vaccine? They said they want to listen to doctors from their own ethnicities in their own language. So so we will be asking what makes you trust the vaccine?
Nubian Life will really be pleased to work alongside and with.
So I can't tell you because I don't know what is the strategy. As I mentioned earlier, we tried call and recall, we tried sending letters, and it is not reducing the inequalities, and it's not improving fast enough for us.
I mean, that's why I said a proactive strategy which looks specifically at the historical issues of confidence and mistrust around immunisation. Thank you.
Yes.
I think one of the emerging problems is the migrant and refugee communities, yeah? And I think there's fear at the moment, given I'll be honest about political climate, that kind of is putting them in a place where they don't want to approach formal services, and I think we need to be aware of that, and to reach those communities requires we work with mosques and others to try and kind of reach out in health messages. But I think it's an increasing problem, and just to raise awareness of that is having an impact, not only in terms of the health inequalities, but mental health as well.
Yes, Diane.
I agree with everything that everybody's said so far, but there was one other thing that I think we found was dealing with the trust issues, having people from the community, having NHS professionals or health professionals, all those things are brilliant. But the last thing you need is actually for it to be easy and accessible, and it's, you know, to be there and then. So if you deal with the trust, you actually, if you're with a homeless or migrant community, that you actually have people there who can give them the vaccine there and then after talking to them. And then, but if it's there, there's so many issues around GP access at the moment, whether they're real or perceived. People think that they can't access the GP so easily. So, and I think we found that in COVID as well. If you've got the vaccine there, just the uptake is so much better.
There is the option of having roving teams, so or domiciliary services as well, in terms of vaccination, working with our NHS colleagues, but identifying how we will reach, what are those communities, and then would if we reach them, would they take the vaccine? I think, but access, I'm hoping it's a less of a problem compared to the trust issue, and compared to convincing them to take the vaccine.
Thank you. Yes, I echo Councillor Sanderson's thoughts in that it's such an important plan. We've been hearing about our low vaccination rates for a few years, so it really is urgent now, and the fact that we are, you know, there's diseases and things that we can't address and we don't have things for, but then we actually have vaccinations. I did some work myself during COVID, working with the East Asian community, so I've got some experience on it myself, and I know that it is about trust and reaching the right communities, and preaching and sort of being condescending doesn't work, and that's the sort of purely medical approach often doesn't work when you're dealing with people who are sort of have been let down by the health system, and with that, the community I was working with at the time, they were receiving sort of racist backlash because of COVID. I had a different question. I wanted to know, going back to COVID, whether, so during COVID, we saw obviously an unprecedented sort of rollout, sort of quick, there were structures set up, sort of vaccination network, sort of it went from sort of health situations to communities to pharmacies and so on. Has any of that sort of infrastructure that sort of, that we rolled out, does any of that, I know the pharmacy network exists, but have we learned anything? Is there anything there that we could utilise and lean on again? Because it felt like we did a lot in a short amount of time, although we obviously still could have done better, but then that all seems to have shrunk now. And although we have memories of COVID, I'm not sure whether we've learned and put into place things that we could have done.
I'm not sure if we're as a country, we can set up like vaccination centers in 48 hours, like in COVID. But what I know in London, there is a measles control group headed by the Regional Director of Public Health and UK SHA, and the directors of public health are represented there as well. So there are vaccination groups, and there is national work as well on improving measles, but so far I haven't seen a like in-depth engagement to inform plans really. So I'm hoping we would be able to not just to be a pathfinder in terms of informing the rest of London on the work we are planning to do.
Great, thank you so much. Yeah, we look forward to getting data and hopefully seeing an increased vaccination rate in our borough. Okay, so the committee, the recommendations are that the Health and Wellbeing Board support the system-wide multifaceted improvement plan, and that we support the effective system partnership to implement this plan with NHSE, Vaccination UK, primary care, secondary care, social care, schools, care homes, and the VCSE sector. And number 3, champion vaccination within services and communities to improve uptake and reduce inequalities. Is that all agreed? Thank you. And coming back to you for number 8, Dr. Mayeda Abu-Fan, it's the oral health update in Hammersmith and Fulham.
Thank you. This is for information. And so as you are aware, the responsibility for oral health came to local authorities with public health in 2013, and we receive specific budget for oral health. Dental caries is one of the very few diseases that's 100% preventable through proper brushing, healthy eating, and healthy lifestyle, and fluoridation. So really, this is just to inform the board about the progress, and our plan is wider beyond supervised toothbrushing for early years. So it covers workforce training in terms of frontline staff, community engagement, and also we have a number of resources to inform or to around health promotion around oral health for residents and for also frontline staff, and around partnership working as well. So with schools, with education, and with primary care, and with the third sector as well. So our supervised toothbrushing, it is up and running, and it's focused on early years, and it aims to improve early oral hygiene. And then we do have targeted dental access for children pilot with 2 dental practices in W12, both of them. And the really inclusion criteria for this pilot is to send any child up to 16 who didn't see or he didn't visit a dentist for 2 years, or who have dental problems, and the recruitment is usually through family hubs and others, and primary care as well. So really, it's just oral health is a significant public health problem and issue. We all know that children needing dental treatment, it is done under general anesthesia, so that is risk to the child, and it is more resources to a disease that could be really easily preventable. And then really, I would like the board to notice the progress in the oral health delivery plan.
Thank you. Okay, do any members? Councillor Sanderson.
Thank you. Good that it's a final paper, because it'll be the final intervention from me. But just wanted to say, again, much like the vaccination paper, I am delighted to see this, but it is shocking that it's needed. I think the stat is something like 1 in 4 5-year-olds has got tooth decay in England. It's the leading cause for hospital admission for our children. It is shocking in this day and age that Victorian era disease that is entirely preventable is still something that we're dealing with. So really welcome this. Thank you so much for the work on it. Really looking forward to it, hopefully having an impact. Again, much like my earlier questions, could you talk us through inequalities? Because we know that there is obviously a gap between the most affluent households, which I think have got a tooth decay rate of something like 13% versus almost 40% for the most deprived households. So could you talk us through how inequalities will be tracked through this?
Yeah.
Thank you.
So supervised toothbrushing scheme is, it is across the most deprived wards in the borough. So we're focusing on the most deprived. Information is delivered across whole primary school and early early years, but the actual scheme itself, which gives a brush and a toothbrush and toothpaste and others, and also information around healthy eating is really concentrated around deprived wards in the borough.
And then in terms of just tracking, will there be in-depth tracking of outcomes for different communities, different ethnic minorities as this moves forward?
It is a national data. I need to check, but it is a national data, and we can track the number of supervised sessions done and the number of children reached, but I'll check the availability of national data and get back to you.
Thank you very much.
I had a question, and that I don't think we talk enough about the link between oral health and whole health. And believe me, I think when you're older and of an ethnic minority and have type 2 diabetes, not mentioning any names myself, but it's really linked, and it's really miserable. And I don't think with the young, we talk a lot about good dental habits and getting them sort of, stressing the importance. I wonder if there's a non-scary way that we can actually also impart that. If you don't, it's a very miserable existence you see. In older life, I think things like implants and so on are so expensive.
Yeah.
They're so painful, they don't always take, and so on. And the number of people I've spoken to just, I wish, from when they're younger. But people see it almost as isolated. It's like, this is my teeth and this is the rest of my body. Yes, I wonder whether that's something that in the plan we can think about as well, to stress that it's not, it's not isolated. It will affect other parts of your health as well.
Absolutely. So oral health, I think for adults is NHS England responsibility, but we can liaise with them because it is related to coronary heart disease. So in adults, so poor oral hygiene can increase the risk of coronary heart disease for adults. So I'll take that on board and see if they have plans for campaigns, or we can develop our own locally. Absolutely.
And maybe it's talking to the parents at that age. They will, I think, take it more seriously than just children. Yeah,
absolutely.
Yeah, thank you.
Thank you, Maya. So Navneet from CLCH. So we have the oral health promotion team within our wider community dental service that we provide through CLCH, and we have a number of our dentists and endodontists who have specifically talked in some kind of quality and sort of patient examples around our quality governance process of the impact and some data. So we'd be really keen to link that up if they haven't already done that. And we do that as part of our clinical governance within the division. So that data is definitely available, and how we work together to make it palatable and friendly to the audience is something we can certainly deliver, and might also link to some of the work that we already know is taking place within family hubs. That's a good link there, I think.
Thanks. I think the idea of reaching parents as well through family hubs, I think that's good. So I'll be in touch. Yeah, thank you. Thanks.
Would you like Yes, if you could just come to the microphone so we can have them on.
Just a shout out to say that we had a visit on Monday from.
Sorry, can I ask you to
I'm
introduce yourself?
Coles from the Hammersmith and Fulham Dementia Action Alliance. We had a visit from an oral health expert to visit with Good Life with Dementia at Mind Sports on Monday, and with carers and people with a diagnosis. And it was so, well, everybody said, we've already learned 3 things. You have to not spit. No. You don't rinse. You don't rinse, et cetera. Yes, exactly. So just to say that some of these projects that are being done, it may be possible to use a special cohort and show how it's helped them as a way to bring the story home for other people that either think they don't need it or they already know that. So, you know, it might be something that a child wants to tell his grandma. Okay, thanks.
Thank you, Peggy. Okay, I don't think I've got any other questions or comments. So do the members of the Health and Wellbeing Board note the update to the oral health report? Thank you. Okay, number 9, our work programme. Do members have any suggestions for the work programme, mindful of the fact that we have the election coming up in May?
Yeah,
So
I think let's take that offline till after
Yeah.
the election.
Yeah. But yes, please do. I think most of you have our contact details, so you can always write in with suggestions, as I know some of you do already. And are the dates of the future meetings noted? Thank you. Okay, all noted. That's the end of tonight's meeting. Thank you ever so much, and